Nursing homes are confronted with unique problems associated with long-term immobile patients. These patients require intensive efforts by the staff to combat all the myriad health problems associated with immobility. Nursing home regulations mandate aggressive care plans for those patients who cannot ambulate or who present special difficulties in being transferred to a wheelchair. VitalGo has introduced the total lift bed to address this problem. With the total lift bed, all of your immobile patients can be safely secured in the bed and tilted to an upright position. We understand that while you see the therapeutic benefits of tilting the patient to a near upright position, you are concerned with knee buckling. Therefore, we have developed a safety strap system that your staff can easily use to secure the patient in the bed and avoid knee buckling. Lying immobile for extended periods of time increases the risk for several different pathologies. Pressure sores, respiratory infections, digestive disorders, and bladder infections are of constant concern to your facility. The caregiver can achieve any angle between 180 degrees and 85 degrees. It will be common for the patient to be brought to a near vertical position over time. Of primary concern is patient tolerance. Therefore, the total lift bed has the added feature of allowing the caregiver to control both the vertical angle and the weight on the patient's lower extremities. If the patient is suffering atrophy or lower extremity contractures, gentle and controlled weight bearing can be implemented as part of the patient's care plan. To those who suffer a life of lying prone, the total lift bed offers many quality of life improvements. Patients who can be brought to near vertical experience improved orientation and an improved disposition. Nursing home referral sources will be impressed with this new modality. Whether it is a short-term rehab patient or a long-term care patient, the total lift bed delivers a new and exciting treatment option. The total lift bed can be used in your rehab department or for bedside rehab by your physical therapist. The functions of the total lift bed can be adapted to respond to many different care plans. For example, patients who have not experienced weight bearing on their lower extremities can be secured and gently tilted in order to test weight bearing capabilities, address atrophy, and combat contractures. The total lift bed can be a part of your care plan to gradually allow the patient to experience weight bearing over an extended period of time. Your professional staff can allow the lungs to expand and blood to flow with control and precision. The total lift bed can transform itself into a chair. The total lift bed can be elevated to a treatment position. The total lift bed can be positioned to elevate the lower body. In today's competitive environment, any new treatment modality that interests your referral sources will pay for itself many times over. Your facility can implement new quality management programs and introduce new physical therapy programs with this new technology.